Good afternoon, everybody, and welcome. It's great to have a lovely bunch of people coming through and listening to this session of the National Standards. We are up to standard number 6 overview of the National Standards for Volunteering. My name's Diana Piper, as you would know, and I present these along with Aisha. I'll be introducing Aisha. She's running the session today. But before we get going, I would just like to, of course, do a little welcome for country, or acknowledgement of country. So the Centre for Volunteering acknowledges the Gadigal people of the Eora Nation as the traditional owners of the land on which our office stands in the Rocks in Sydney. We recognise the importance of their connection to place and community on these lands and pay our respects to the elders past and present. I'm, however, not in the office today. I am sitting on Darug and Guringai country in the northern suburbs of Sydney, up in leafy Hornsby area. So I also pay my respects to the elders past and present as the traditional owners of this land. And please feel free to add where you are coming to us from today in the chat if you'd like to. It's always nice to see where everyone is sitting and listening to us from. So we will get going with this session. As you know, Aisha and I alternate these sessions, these overviews, and then they are again followed by a case study, which will be presented by Kylie Elliott from the Sydney Children's Hospital Foundation. Kylie goes into each standard in a little bit more detail. So that session will be coming up on the 10th, I think. Yeah, the 10th of August. So if you haven't already, please feel free to jump online after this session and register for that. She's always a very interesting view on things, and she can share her experiences of implementing the standards. So today's standard is quite short. There's only three points to it. So we may not take all that long to go through it, but of course there's plenty of time at the end for questions. So please feel free to pop questions in the chat as we go through. I'll do my best to sort of answer those or draw them to Aisha's attention, and we can discuss them at the time. But at the end of the session, of course, there'll be plenty of time for questions, and we've got a lot of knowledge in the room. So please feel free to chime in and use that time for a general discussion if you'd like to, because it's always interesting to hear people's views on this subject. So this standard is all about workplace safety and wellbeing. So that is what we'll be discussing today. And I think without further ado, I will hand over to Aisha. Thank you, Aisha.
Thanks, Di. I'm Aisha Dalkich. I work with Di and have known her for over 15 years. And I come from, I guess, a health background, and some of the anecdotes that I'll be presenting today or experiences that I've had along the way that support the workplace safety and wellbeing standard, I'll discuss from a rehab setting or a hospital setting or a disease setting, for example. So, and you're very welcome to chime in from what area you are, because the non-for-profits are in all different areas of this society, and we're blessed for having that richness in our community. But some of the things that we might be discussing may or may not be relevant in terms of the organisation at the moment, but you can certainly tailor it to your own situation as you think through. So workplace safety and wellbeing is number 6 of the national standards, and there's 8. So there isn't much left until we complete all this through to the end of the year. And I hope you've enjoyed the journey with us as Di and I have been presenting this through from the beginning of the year, and with Kylie supporting with case studies. So Standard 6 is about the workplace safety and wellbeing, and it's about making sure that you have a structure in place where your working relationships with your employees and your volunteers are facilitated by the organisation. So you're responsible for organising the events that are happening in the organisation to support the mission and vision of the organisation. But when you do engage with the volunteers as a volunteer engaging or involving organisation, you are responsible by law and for their welfare whilst they are performing their tasks with you. So you are responsible in setting up processes to protect the health and safety of the volunteers as their capacity is, as you've invited them to become a volunteer in your organisation. So whatever role that you've set out for the need of the organisation, that you have matched the volunteer for because they've got the appropriate skill sets, you've interviewed them, you've done your cross-checks with your compliance, you've made sure that they're well, and if there needs to be any reasonable adjustments for their situation or personal condition, that you support them through their volunteer processes, through the volunteering tasks, through the processes that you've set out before they've come on board. And that's really important, to take the onus on yourself as a volunteer manager, and in that relationship that they prosper in the role that they're in. So if there are any volunteers, they need to know if there is a grievance, how they can go about raising and having their voice heard. If there's a complaint, or in terms of any hazards, that there's a register for them to know where to go to. So as a volunteer manager or volunteer coordinator, I would always welcome them on board with an open door policy to say, I'm usually here in this workplace. If I'm not, my colleague will be there to help you. If there's an issue, don't sweep it under the carpet. Always raise these issues because it could be a bigger issue for someone else. Some people might be confident about certain things and confident, others may not be, and it could be a disaster in waiting. So it's really important when there's alarm bells to hear those alarm bells and validate what's said by your volunteer, that it's registered, and that you keep them posted through the process of minimising and therefore hopefully eliminating any risks there may be in their environment that they've seen or highlighted. And validating what the volunteer has said is really important for them to know that they're part of that team and that they feel valued in that organisation, and that everyone else is as well. So they feel that equality in the service that the organisation is providing to them, and that their volunteering is providing a positive impact to the organisation, and what they do and what they say is important. So what we're doing now is just dissecting Standard 6 into each of its subsets. So effective working relationship with employees and between volunteers is facilitated by the organisation. So having an organisation that has the structures in place that's relevant to staff, and how you communicate that to the volunteers. And where requested, volunteers are provided with opportunities and resources to meet collectively regarding their tasks with the organisation. So, for example, you've got as a beginning point your volunteer role description that you've putting it across to the volunteer to say, this is what we have discussed, and we hope that you would join us in this organisation. And here is the actual task that you have to perform. You may have an organisation that's large enough where you may have to identify two people, for example, a professional manager and an operational manager. The volunteer manager is the direct line where a volunteer could come across and say, look, there's an issue and I need to discuss it, or I don't know how to go about this or that. But if you've got another manager, the professional one, that they're, for example, in that rehab setting, if they're supporting someone with feeding, for example, they've had the support and training from a speech therapist, because it's really important how small the bite sizes need to be, at what angle you sit next to the patient to be able to feed them. And in terms of safety for the patient, you actually need to make sure there's no choking hazards. So the overall safety of the workplace is important, and that is through your training to the organizer, to the volunteer, and making sure it's listed on the role description. You would provide your volunteer with an organizational chart so that they would know who's who in the zoo. For example, if you've got a monthly organizational orientation day, you would invite them to that monthly, but if they needed to start earlier, you would get them onto a site orientation with it, whether it's in that shop or Vinnie's, for example, or the ward in the hospital, or around doing meals and delivery. But if there's an overall organization orientation day, you would invite them for that as well, so that they get that complete picture of what the organization is. You should also note to them as you walk across the site orientation where there's notice boards where there would be work health and safety minutes and meetings identifying when they happen, and that they are also welcome to join those meetings. And that's really important for them to know that they can join. And if they wish to be raising an issue, they can certainly raise it there as well, if they haven't already done so with you. And if you need to be part of that meeting, you would, as a volunteer manager, be part of it as well. So we go on to the processes are in place to protect the health and safety of volunteers in the capacity as volunteering. The health and safety management policies and procedures are include the volunteers. So I would expect that you would have a staff and volunteers onboarding booklet. So it's a welcome pack when they join you, that they know that whatever they do and what is expected of them as a volunteer is the same rules and guidelines, policies and procedures that apply to both the staff and the volunteers. You would also expect that the organisation would have currency in their insurance, whether it's volunteer insurance or personal and public liability insurance, because they may be in events, there may be fundraising outside in parks, for example. You have the gong cycling rides, for example, or the motor neurone disease walks annually. So they're outside in a exposed area where trips and hazards may not have been highlighted earlier, but you need to make sure that your insurances are going to cover for any of those misadventures that could happen outside of your workplace or your regular workplace, but it's still part of the volunteering role. Volunteers have access to the same post-incident debriefing and support provided to employees. So if something has happened, that they feel that they will be supported, and whatever is required, that you would be addressing that need for the organisational responsibilities towards the volunteer engagement. Expectations and limits of volunteer roles, including time commitments and designated hours, are agreed with volunteers, and individual workloads of volunteers are monitored and managed. So here, the organisation should be having, at the basic level, as you walk into your volunteering space, a sign-in and sign-out sheet. If not, if that's not possible, because there's multiple entry levels into the organisation where volunteers come in through different, doorways and work in different spaces, you could provide them with a timesheet when they would be logging their timesheet. Either it's a physical one or on a database that they can enter their hours coming in and make comments as well. If something happened that was positive or negative, if there's a comment column, it's really good when you're collecting it every month from the timesheets, that there's something there that they felt worthy of writing. And it'd be great as a volunteer manager to go back and say, look, tell me more about this incident, or was there something of concern that we need to be raising and highlighting to executive to resolve or minimise an issue that might have come to the surface. It's also good to manage the hours that the volunteer is donating to the organisation, because best practices is that they shouldn't be doing 16 hours and that they shouldn't be replacing staff. So it's really important that you monitor that. And if they are doing more, you need to actually look at your staffing levels and possibly looking at employing someone for that role. There are volunteers that are full-time volunteers through their week because they volunteer at several non-for-profits, and that's how they manage their time. That's what they enjoy doing. That doesn't mean they can't do it because they've done more than 16 hours, but it's because it's spread out throughout other organisations that it's okay for that to happen. So as an entry level into the organisation, you should provide the orientation. You should provide links, if not excerpts from policies and procedures, code of conduct, and you should be doing a site orientation so they know where and who they're working with. And if it's to be with a health professional, for example, they need to have that specific training with a health professional to support a patient in a hospital setting, for example. They should also be given that opportunity to know where there's an incident register if there is a complaint, and if there's an issue that we would take note and come back to them with a resolution, as I mentioned earlier. It's also important to give them, if your organisation does have an employee assistance package, contact lists and brochures, because the issues that people are confronted with nowadays and their workplace, their volunteering workplace, is where they feel comfort, but it may also be a part of where stresses have risen. So if they want to talk to someone independent and have some counselling, that is certainly an opportunity you would encourage them to have if it's something that's beyond your capabilities with your workplace in terms of being the volunteer manager. You do need to, if it's a personal issue, if there's a grievance in the family, and when they say that they're down, for example, you want to be able to say, look, we care for you. You're an important member of our team. And if you feel the need to talk to someone independently, here's a counselling service, and we won't know that service has been taken up. It's just there and it's free to volunteers and staff. So please, utilise the service if need be. Sometimes just that opportunity of saying that to your volunteer lightens the weight that they might have been feeling in themselves. And it's a good reminder for all of us to know that these are also available for us as well. Volunteers have access to complaints and grievance procedures, as I mentioned, where there's a register. Volunteers are given the information regarding how to make a complaint and raise a concern within the organisation to relevant external parties, if need be. Grievances from volunteers are managed consistently, transparently, equitably, and in line with principles of natural justice. So being an employee, we know that we are covered by certain statutory laws in workplace health and safety. It's important for volunteers to know the same, and that they are covered by that, and that they feel the comfort in knowing that they will be protected if something was to happen, and that there is a register in which we would be looking at and replying and solving any issues if there was anything there. So as I mentioned, the orientation processes are really important, where we can highlight these to our volunteers, and the volunteers are in their welcome pack given their rights and responsibilities, and as also repeated in the position description that they will be also given, and that you would expect them to sign, so that they've got a copy and we've got a copy. They can always come back and say, look, I've been asked to do more. Can I do this? And you then have to review the hours that they are donating to the organisation through volunteering. And if it's in addition to that, you would need to say, look, we might need to reduce the hours that you initially were doing in this role for you to be able to do this extra role. Because if that's what you want to do, that gives you that diversity and joy in the volunteering that you're doing. It's important for them to be given that consultation. What would you prefer to be doing? Their skill sets are still applicable to that other role. We've gotten to see how good they are and reliable they are, and we want them engaged in other volunteering role. So we just monitor the hours and make sure that we're not overly working obviously, and them donating, and they don't feel that they've been exploited in their volunteering donating hours. So we need to record the grievances if it's received. We need to action it as soon as possible, and that record management of any concerns are kept and diarised, and that they are transparent, and that your executive is aware of it as well. So you do report that upward in your line as you solve those issues that has been raised, if it's of major concern, or even if it's minor concern, so that it doesn't become a major problem. I remember one day, as an anecdote, walking out having lunch with one of our volunteers, and we were together. We were walking down the pathway, and the gum nuts had dropped the gum nuts, the tree, and the volunteer had actually rolled and slipped whilst next to me. So that was something that, even though she stood up and said she was fine, I witnessed it. I registered it on the incident register and made sure that I rang her back the next day to make sure nothing further developed from, and that if she needed to see a doctor, she should go, and we would make sure that, and just to let her know that we would cover her in terms of if there was any further ongoing health care needed for her, because it could happen to anyone, but she was doing her duty as a volunteer, and it was just as simple as a gum nut going under her shoe, and it just made her slip, for example. So it's really important to put these registers into place and have procedures where these are noted and they're transparent, and the date and time and witnesses, and the actual event is itemised there for everyone to come back to if there was to be a concern later on in her healthcare, for example. So I wanted to highlight to you in this slide a risk matrix, so that you would consider this if there was an event or if there was corporate volunteering, for example, and they were going to come in and do something different than your usual volunteering. We had, for example, a sensory garden or raised garden beds in the health facility that I worked in, and it was important that there was gravel there because the gravel was needed for the pathway for the wheelchairs to come through. But it might be an issue, and if someone was to fall, for example, we need to highlight all these issues, and using herbicides or anything to wear the masks. If there was gardening equipment, we needed to give them, the volunteers, if it's corporate volunteers, that morning of training, how to use, make sure that their space around them was clear when they were raising a gardening tool, for example. Yes, of course, common sense is a common sense, but not everyone has common sense. So it's important to highlight certain things that could go wrong and make sure that we minimise all risks when we're coordinating groups of people. And one anecdote I wanted to say, is a really exciting event that we planned for was to have wheelchairs on ice skating ring. And can you imagine the risk matrix that I had to work through of having a wheelchair go on an ice skating ring, or someone who was unstable on their feet, where we actually put them onto a chair and we could, the volunteers and staff could actually wheel them in and have the joy of being in an ice skating rink. The whole environment was so vibrant, but the back end work was incredibly important to make sure that no one fell off their wheelchair or off their chair, and if they did, what to do with their hands to make sure that their body came close so they didn't risk. We minimised the number of people that were in the one space at one time. Though it was an amazing day, it was certainly something we had to make sure that the insurance was covered, the number of people were monitored, the volunteers who were invited to be part of this event, spectacular event, were trained or had at least minimum ice skating ring skills for themselves. Like, I wouldn't be the best person to be pushing a wheelchair, but I was there monitoring them as they got in and got off into the ice skating ring. So I knew my limitations, and it's important for a volunteer to express And we would make sure that we'd take them out earlier, see how they were, even though they might have ice skated years ago. You want to make sure that they're still competent, and they may have the confidence, but they may not have the competence. So it's important to be able to check these things before we do that. So this is something that I've actually taken out of our knowledge base, which is on the website, and there's over 160 articles and templates that you could download and have a look at and use to your organization's benefit. And this is one that I pulled from there. And the next page also is of the traffic light system of, highlighting any risks that may be happening. So if it's insignificant, but it needs to be noted, if it's minor, moderate, major, and critical, that's when you actually really need to look at what you're doing. And, is it something that's essential that has to take place, and how you could, reduce risks and minimize it and hopefully eliminate the risks. So that's where your decision making is so important. And you express that transparently to your volunteers. And if it's a corporate volunteering day, that you say this as well to them, and it's documented, and that they know that your duty of care to all volunteers and those around them are, respected. So I hope you spend some time to get onto our knowledge base and have a look at the resources that we have available for you, and that these are there for you to make your life as a volunteer manager and a coordinator easier. Do look at these things, in part, and then you'll know that it's available for you when you do need it. So start your processes, and then you can analyze and look at the gaps that you might have. And if there's a gap, go onto the knowledge base, and you might be able to find something that can fill the gap, and know that you're meeting the standards as you work along with your volunteers. So if you put these procedures in place and notify them of the policies, then you're doing the right thing by your volunteers as you manage them. Something that came across my table this morning was, I thought, something that's important to share with you today. Not only is it a physical issue that we may be dealing with in terms of, an accident, but it's also the stress levels that the volunteers may have, and other issues that may be happening. For example, if there's negativity in the workplace, or if there's bullying behaviours within the team, how to go about how to resolve these issues if it is, and it's impacting their volunteering, and it's causing a barrier for them to, have joy in what they're doing. Volunteers need a safe working environment, and it's important for you as a volunteer manager to ensure that that is happening, and that they feel the confidence in you as the professional person for them to come to and address that, look, there's a problem here. I'm not able to do my job as you've asked me to do because someone's causing a barrier for me, for example. So it's important for you to hear them and see what you can do. We at the centre have a relationship with not only, as I said, the employee assistance package, but also counselling and mediation processes that can take place if it's got to a stage where the parties know and identify that there's possible barriers because of bullying or negativity that's in the culture. And it may be that the overall culture is okay and fantastic, but there may be subcultures that you're not aware of because the volunteers prior to that particular volunteer didn't highlight it. They kept on leaving, and you wondered why the retention rate in that particular environment or that particular department was because they were just leaving and they were excusing themselves, saying, I haven't got time, for example. And then the one volunteer comes across and says, look, I really enjoy what I'm doing, but there's certain issues or subcultures in this overall environment here that's not conducive to the work and to my happiness. So it's important for you to go back to the managers in that area and highlight these issues and see if you can resolve it to the best of your ability. If not, it could mean that mediation may be required and both parties are willing to go into that mediation process. and you could facilitate that for them. And obviously here we're highlighting mental health issues, and it can affect anyone at any time. And it's something that we would encourage people, if they felt the need to talk about it, that as I said, the open door policy is, yes, open door to invite people to talk to you, but it's closed door in terms of privacy and respect of that person, and how you can help them if you can, lead them to places that can help them. So here is the links to some helpful links and contacts within the government that can support you in doing what you're doing, and volunteers in requiring some free training and coaching if they need to. We can certainly send that to you as a link, or pop it on the chat as we work through this webinar. So we're almost to the end, but we just want to highlight that there's the implementation steps in the national standards, and we'd like you to be able to hopefully identify the benefits and challenges of implementing the national standards, because it's a roadmap for you, and it makes your life so much more easier when you do know what the actual destiny and the journey that you're taking is going to be easier by implementing the national standards. You gain the commitment and support of your executive, your board, your team, your cohort, and you have a team to manage the project of volunteer management. And if you see any gaps, that you identify them, and then you can build resources that we have built, and you can tap into that and introduce that into your workplace, and develop a plan to guide the project, and promote and communicate to all the stakeholders, your volunteers being one of them, of what you're doing, and determine the management system, which is where you as a volunteer manager, you're part of that process, but you're also one cog in the whole scheme of things. So you need your volunteers, you need your executive supporting you, and through clear communication, whether it's newsletters, your social media, you keep that whole, the journey of the volunteers promoted to your organisation, so they know the impact that the volunteers have on the service that you're providing, and that they are also aware of all the policies and procedures in the work that they have to do, and that they maintain, and we maintain that system for them in managing their volunteering. So in future, we'd love you to check our professional development calendars, because we've always got some workshops and events that are coming up. As Di mentioned earlier, there's the case study from Kylie that'll follow this. We'd love you to look at our knowledge base and reach out to us. Di and I are at the other end of the help desk, so you can send us an email, give us a call, and if there's, for example, you're developing a volunteer program, that's because we're coming into the summer months or warmer months a lot sooner now, it's good to think about, if you're going to be developing new programs, for example, if it's a swim school and it's something that you hadn't done before, how are you going to train your volunteers to be water smart and to be able to support the program? So if your insurance isn't covering it, you need to look at that. You need to look at possibly having the volunteers that have already got a swim skills or life-saving skills. So they're the sorts of things that, if you've got questions about, we're happy to discuss and bounce around ideas, so that you might have thought, oh, what about this? And we go, what about that? So it's really good opportunity for us, because it gives us an opportunity to also develop different resources where we see the gaps in terms of the volunteer programs that you're designing. So please do consider the 10 steps to implementing all the national volunteer standards, and do take time, because when you're thrown in the deep end in a volunteering management role, whether it's been done prior to you or you're starting it out yourself, take time, think it through, reach out. We're here to support you. And it's really important, these standards, for example, to know that, the workplace takes so much of our time. And if there's joy given back to the volunteers because they enjoy being a volunteer with your organisation because they saw the call out, or you're in the neighbourhood and it's convenient for them to come and join your organisation, we want them to be happy and safe and well, and that they keep on keeping on and volunteering, so that your resource in terms of trying to recruit new volunteers and retain them. If you're spending so much time in recruiting, you'd want to at least know and design programs and make sure that you're tapping back to and checking that they're happy, that they retain their volunteering role, and that they're proud in what they're doing, and that they talk about it when they go out to, family events or outside, because they're your ambassador. If they've retired and they're going out to be with friends and they say, "And how's your week?" "Oh, I love what I do with the Centre for Volunteering," for example, in their volunteering with us, for example. And it'd be lovely for them to do that, because it's free advertising.